Understanding chronic pain, causes, symptoms, and implications. Chronic pain is a pervasive medical condition affecting millions worldwide, characterized by persistent discomfort that lasts beyond the typical healing period. Unlike acute pain, which serves as a warning sign of injury or illness, chronic pain often persists for months or years, significantly impacting daily life and mental well-being. This article explores the complexities of chronic pain, its underlying causes, symptoms, and effective management strategies. What is chronic pain? Chronic pain is defined as pain that persists for more than 3 to 6 months, beyond the expected time for tissue healing. It can arise from various conditions or injuries, including injuries, traumatic injuries such as fractures or accidents. Medical conditions, conditions like arthritis, fibromyalgia, or diabetic neuropathy. Nerve damage, neuropathic pain resulting from nerve damage or dysfunction. Autoimmune disorders, conditions like rheumatoid arthritis or lupus. Post-surgical pain, pain that persists after surgical procedures. Psychological factors, chronic pain can also be influenced by psychological factors such as stress, anxiety, or depression. Symptoms of chronic pain. The symptoms of chronic pain can vary widely depending on the underlying cause and individual circumstances. Common symptoms include persistent pain, pain that lasts beyond the expected recovery period. Sensitivity, heightened sensitivity to touch or pressure. Allodynia. Throbbing or aching, dull, persistent ache or throbbing sensation. Fatigue, chronic pain often leads to fatigue and decreased energy levels. Mood changes, anxiety, depression, irritability, or mood swings. Sleep disturbances, difficulty falling asleep or staying asleep due to pain. Limited mobility, reduced ability to move or perform daily activities. Impact of chronic pain. Chronic pain goes beyond physical discomfort. It significantly impacts various aspects of life. Emotional well-being. Persistent pain can lead to anxiety, depression, or feelings of hopelessness. Social life, limitations in mobility or discomfort can affect social interactions and relationships. Work and productivity. Chronic pain often results in decreased productivity and may lead to work-related challenges or disability. Financial burden. Medical treatments and reduced work capacity can impose financial strains. Diagnosis of chronic pain. Diagnosing chronic pain involves a comprehensive evaluation by healthcare professionals. It typically includes medical history, detailed history of the pain, its onset, duration, and aggravating or alleviating factors. Physical examination, evaluation of the affected area, assessing mobility and sensitivity. Diagnostic tests, imaging studies like MRI or CT scans or nerve conduction tests may be conducted to identify underlying causes. Psychological assessment, evaluation of emotional well-being and potential psychological factors contributing to pain perception. Treatment and management strategies. Managing chronic pain often requires a multimodal approach tailored to the individual's specific condition and needs. Treatment strategies may include medications, pain relievers such as NSAIDs, nonsteroidal anti-inflammatory drugs, opioids in severe cases, carefully monitored, or antidepressants for nerve-related pain. Physical therapy, exercises, stretches, or manual therapy techniques to improve mobility and reduce pain. Interventional procedures, injections like corticosteroids or nerve blocks to alleviate pain or inflammation in specific areas. Psychological therapy, cognitive behavioral therapy (CBT) or counseling to address psychological factors contributing to pain perception. Complementary therapies, acupuncture, yoga, massage therapy, or mindfulness-based stress reduction techniques. Lifestyle changes, nutrition counseling, weight management, and ergonomic adjustments to improve overall health and reduce pain triggers. Support groups. Participation in support groups or chronic pain management programs can provide emotional support and practical coping strategies. Self-management techniques. Individuals can also take an active role in managing chronic pain through self-care strategies. Exercise, regular physical activity can improve strength, flexibility, and mood. Healthy diet, a balanced diet rich in fruits, vegetables, and lean proteins can support overall health. Stress management, techniques such as meditation, deep breathing exercises, or progressive muscle relaxation can help reduce stress and pain perception. Sleep hygiene, establishing a regular sleep schedule and creating a relaxing bedtime routine can improve sleep quality. Pacing activities, breaking tasks into manageable segments and pacing activities to avoid overexertion. Mindfulness, Practicing mindfulness techniques to increase awareness of pain triggers and responses. Challenges in managing chronic pain. Managing chronic pain can be challenging due to its complex nature and individual variability. Some common challenges include medication side effects, potential side effects or risks associated with long-term medication use. Psychological impact, emotional distress, anxiety, or depression related to ongoing pain. Access to care, limited access to specialized pain management services or treatments. Stigma, misconceptions or societal stigma associated with chronic pain conditions. Treatment response, variability in individual responses to treatments, requiring adjustments or alternative approaches. Research and innovations. Ongoing research aims to improve understanding and treatment options for chronic pain, advances in pain management, development of new medications, therapies, or medical devices targeting pain pathways. Personalized medicine, tailoring treatment approaches based on individual genetic, biological, or psychological factors. Integrative approaches, integration of complementary therapies with conventional medical treatments for comprehensive care. Patient-centered care, emphasis on patient education, empowerment, and shared decision-making in pain management. Conclusion. Chronic pain is a complex and debilitating condition that affects millions worldwide, impacting physical, emotional, and social well-being. Effective management requires a comprehensive approach addressing physical, psychological, and lifestyle factors. By combining medical treatments, therapies, self-management techniques, and ongoing support, individuals can improve their quality of life and reduce the impact of chronic pain on daily functioning. Through continued research and innovation, there is hope for advancing treatment options and improving outcomes for those living with chronic pain. Empowering individuals with knowledge, resources, and support networks is crucial in promoting holistic care and enhancing quality of life in the face of chronic pain challenges.